Our dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. Obsessive compulsive disorder is a mental illness which is mainly manifested with obsessions that lead later to many compulsive behaviors. This means that the patient usually has repetitive unwanted thoughts in his mind and massive urge to do something in response to these thoughts. For example, the patient checks many times if he locked the door although he is sure that he was already locked it. So, patients of obsessive compulsive disorder know that their thoughts and behaviors are illogic, but they can't stop it. The exact cause of obsessive compulsive disorder is still unclear, but some medical studies showed it could develop due to a defect in the brain response to serotonin. On the same side, other studies showed that there are certain risk factors which increase the incidence of the disease. These risk factors include the following. 1. Positive family history of obsessive compulsive disorder. 2. Exposure to emotional stress. 3. Psychological disorders such as depression or anxiety. 4. Sexual or physical abuse during childhood. 5. Genetic defect. 6. Eating disorders. 7. Attention deficit hyperactivity disorder. Also, it's found that obsessive-compulsive disorder is more common in females than in males, and commonly develops among teens and young adults. There are many types of obsessive-compulsive disorders. All of them consist of illogic repetitive thoughts, obsessions, followed by illogic actions, compulsions. According to medical statistics, the most common types of the disease include the following two main forms. Obsessions include fear of dirt or contamination and compulsions of excessive cleaning. Obsessions related to perfectionism and compulsions of excessive ordering. Also, the patient is usually involved in fears of harming oneself or others, which explains the impulsive attitude of most patients. Anyway, it's noted that exposure of the patient to stressful events markedly exacerbate the associated symptoms. Diagnosis of obsessive-compulsive disorder is applied by mental health specialist who uses many specific tests for proper assessment and diagnosis of the condition. Also, checking the current symptoms and talking to the patient are necessary to identify the degree of the obsessive-compulsive disorder. There is no absolute treatment for obsessive-compulsive disorder, so management plan aims mainly to control symptoms and to help the patient to be involved in his social life normally. This will be achieved by applying one or more of the following measures. Cognitive behavioral psychotherapy. It aims to change the patient's method of thinking as well as helping the patient to deal with stressful events and anxiety. Simply, these sessions will help the patient to control his obsessions and compulsions. Medication. The doctor will prescribe selective serotonin reuptake inhibitors which help the brain to use serotonin properly and then control obsessive-compulsive disorder. These medications usually take 2 to 4 months to start its therapeutic effects. Relaxation. It's usually used as complementary treatment which aims to eliminate stress. Methods of relaxation usually include yoga, meditation sessions and massage therapy. Neuromodulation. It's usually used when psychotherapy and medications fail to control symptoms. Neuromodulation includes using devices which induce deep brain stimulation as well as changing the electrical activity of certain brain centers. Recent therapeutic measures, such as transcranial magnetic stimulation. It's non-invasive device that produce magnetic field which affects certain areas in the brain to control symptoms of obsessive-compulsive disorder. Support the channel to encourage us to publish more.